Welcome to the Female VC Lab podcast. I'm here at Milken's 2024 Global Conference. Thank you, Milken, again for having me. I also have Alice here. Alice, in one line, give me your name, your title, and your area of impact.
Great to be here. Alice Pomponio, VP for Innovation and Impact Investing at American Cancer Society, and also the Managing Director of BrightEdge's, the venture capital arm.
What inspired you to get involved in cancer and BrightEdge and all the things that you do in those areas? And how does one go about doing that?
I think we talk about single story, single career track. This has exceeded my wildest dreams. I fell into this role, sadly, for personal reasons, got involved with American Cancer Society after working in the biopharma industry and in US and UK policy, had helped launch some of the most extraordinary and expensive treatments our industry has known. And then my world was rocked when my mother at 62 years old died from undiagnosed advanced colon cancer. The irony is that she was 62 years old and she was waiting for Medicare. She was uninsured.
Oh, wow.
Since then, our family has had 14 battles over 12 years and 7 different types of cancers. I came to ACS, American Cancer Society, actually as a volunteer and started fundraising, doing the walks and the galas. And before I knew it, rose in the volunteer leadership ranks and ended up on the National ACS CAN board and got the call whether I would be willing to come in-house full-time and help lead their impact investing strategy. So that's my origin story.
And that's wonderful. BrightEdge is a bit of a different way to create impact investing. So can you talk about how BrightEdge came about and how they impact venture capital and how they look at impact investing versus kind of more traditional venture?
Absolutely. I'm a self-taught investor, which sounds a little cringy, but I think for what we do and the impact we're aiming to deliver, having the diverse and multifaceted journey here is actually quite relevant because in life science and healthcare investing, so much emphasis is around novel scientific discovery and accelerating, getting that to patients quicker, doing it in a way that's highly profitable. Most of my career was on the back end, which is fixing other people's problems, making sure that patients could access and afford, working in large pharma, pricing those products, and then getting the reimbursement. So the opportunity with BrightEdge is to operate in the traditional innovation and investment ecosystem, but really drawing down on all of the strategic capabilities of American Cancer Society to build the next generation of more sustainable products that are going to be obviously clinically efficacious and effective, so patient outcomes are achieved, but also deliver social outcomes, reduce health disparities, reduce costs, find ways to innovate for things that the market today isn't as favorable towards, and those communities and cancer types keep getting left behind. If the patient is the market, and it continues to underperform and neglect these broader population and system level issues, we're really in trouble.
We're in big trouble.
We're in big trouble. I say disparities in healthcare are our global climate change. That's what we're trying to address.
And I had a friend that was mixed and she had cancer, and it made me think, did they really look at everything the way they could?
In my mom's case, she had symptoms and she knew something was wrong. She was literally waiting for Medicare. Wow. She was waiting another 3 years when she would have coverage. Wow. And being the child of immigrants, her language skills weren't great. She found healthcare really complex.
Healthcare is complex even without the language.
Even without.
Yes, I mean,
and
it can be very complex.
Being female, she didn't value her own worth, and she was a caregiver for others. She never prioritized herself. Point is that standard of care is not yet the standard for so many people.
That's true, even still.
So Dr. 2024. I know Dr. Knudsen, our CEO, said yesterday that without any new innovation, no new drugs, no nothing, if we just got people access to the care that exists, we could actually see a 20% increase in lives saved.
That's huge.
That's huge.
Just doing nothing. Just like you said, the access, the ability to get what is available.
Get what is available. And so what is that crop of companies now? Those might actually be more tech-enabled solutions.
Yes.
Those might be digitally enhanced. They may even be health-related social needs. So we know a lot about transportation and lodging, rides. Those are things that can actually deliver the same clinical outcome as a brand new medicine. And there could be commercial product development that's targeted around that. And so that's one of the things I'm most proud about is when I first came in, BrightEdge was looking like and trying to establish itself as a traditional investor and get into the hot deals in therapeutics and generate returns back to American Cancer Society so we didn't depend on purely the community level fundraising. And what we were able to do was really highlight the bigger problem we were trying to address and the opportunity to leverage both financial and strategic capital from ACS. So if we spend millions educating people to go get screened, right, and detect cancer earlier, but we're not developing technologies and backing those types of companies, diagnostics, to be successful, are we contradicting ourselves?
That's a good question. Or even, like you said, the transportation and lodging pieces of it. If you're just investing in even just the therapeutics, then are you contradicting yourself?
Correct.
Right?
Correct. And those may only serve a very small portion of total cancer patients, ones who have the privilege and the luxury of having good insurance, who may live close to certain hospitals. When we highlighted that to American Cancer Society and we looked at the investment strategy, and then we realized we were actually sitting on an engine of discovery, meaning on the research side, we're the largest non-governmental funder of cancer research. 50 Nobel laureates have received funding at some point. 25,000 alumni, 1,100 institutions. We had this raging river of deals that were coming, and we could actually get in early, and that generates alpha for a lot of folks, is get in early.
Yes.
On the patient support side, 5,000 communities were providing all of these safety net services. We have operating experience, and we know where are the pockets of greatest need that are persistent. So why isn't that also an engine of discovery?
Yes, absolutely.
And then you combine those two areas with the impact outcomes, not just surrogate metrics, but really knowing what's the problem we're trying to solve here. And the fact that American Cancer Society publishes with the NCI, the CDC, the Book of Truth, the National State of Cancer Care, we can say what are the different types of cancers with survival rates increasing, decreasing. We can point to these are actually problems that are worth solving, and then also hold ourselves accountable and measure the non-financial performance alongside the financial performance.
So thank you for all that. That's so powerful. And we'll continue along some of those lines in a couple of questions. What are you currently reading or learning or listening to these days?
So not cancer related, but I recently moved downtown to the Boston waterfront, and Boston's an old city. So I'm reading this book. I think it's called The 99% Invisible City. It's basically all about everything from what are those squiggly lines on the ground for sewer and electric. So just the story behind the architecture of historic cities. And it then prompts, more questions around, well,
why did they design it like this? Why did they think about it this way?
So much of
What
Boston
was
was actually
purpose of it
underwater.
going like this?
Right. And I think that, I don't know,
That's interesting.
I'm curious.
About design, like how does that, Boston's a very old city. And in those times, how were they really thinking about design and innovation?
And so much of what folks want to focus on is the new. But when we look at what exists today and we reflect on what's the backstory, what was there before, it gives you an appreciation, but it also gives you the perspective to go back and restore, renew, rejuvenate. And so I just feel like it's another version of what we're trying to do here with BrightEdge. Is there's a lot of things that service to product, for example, health systems, hospitals are doing. They are innovative at a program level, but how can we move them into commercial products? How do we build markets around that?
Right.
If we are only focused on novel and new, fast, and accelerate, we start the sentence halfway. And so much opportunity is making sure that we don't make the same mistakes that were made before. We stop doing what's not working to make room for the new. And then the new things are also addressing some of the deficiencies. We design and we build at a moment in time based on the information we have and the
Yes.
tools we have. If we were to refocus on the problem today, what would we then design and develop differently rather than incrementally?
Yes. Yeah. That makes sense. All right. Here's the bonus question. Everyone
Okay.
gets it, Alice. In 2 years, how do you see Bright Edge having changed or evolved?
Oh boy, we've made a ton of progress in just the last 3 years. I think in 2 years, we will definitely have more investment successes. We had already 21 investments, 5 exits. We are absolutely proving the model that impact is not concessionary. It is actually material and it's competitive advantage. We will have fine-tuned our cancer impact investment framework and maybe even helping others evaluate what's the non-financial performance of their portfolios. And we may have some new investment vehicles so that more people can participate and have their dollars work exponentially harder for the areas of greatest need.
So, how do people contact you?
LinkedIn is probably the easiest. I'm on LinkedIn as is Bright Edge, along with X and Facebook. And check out cancer.org. We are
There you go.
right there on the website.
Right there. All right. Thank you so much, Alice Pomponio from Bright Edge.